first thing, which has been just published at the New England Journal of Medicine, is our study on breakthrough infections among healthcare workers during the first 2 or 3 months after getting the second vaccine dose. And what we did there was compare cases of breakthrough infection with controls where we had their serology. They were also healthcare workers who had serology on the same timing from the second vaccine dose as those that got infected. And they were matched by age and gender, et cetera, and comorbidities. And what we saw is that they had significantly lower neutralizing antibodies compared to the controls who were not infected. And that sort of ties the antibodies to the infections. It shows that there's a correlation between antibodies and infections, breakthrough infections among vaccinated people. Together with that, the other pieces of data that have been shown to the Ministry of Health to get into the decision of whether we need a third dose or not, where one is our database on the, as I said, the serology of about 5,000 healthcare workers, where we follow them monthly. And what we see is that there is a significant decrease in antibody titers within 6 months. And on the other hand, we saw a study, which again is not published yet, by the Ministry of Health, showing that we see more breakthrough infections among people who were vaccinated longer time ago, like in January and then February. And as you were vaccinated in a shorter interval from today, your chances of being protected are higher. And together, these two things, plus the correlate of infection, actually are, they give an answer to the fact that we probably need the third boost right now.
Right. But I also found quite interesting in your results that in these so-called breakthrough cases, some of them were less than 6 months, you found that the vaccine still worked to reduce the symptoms, the severity of the symptoms. But in some cases, you saw more persistent symptoms, what you call long coronavirus. Discuss that, because we're hearing that phrase now, long coronavirus.
Yeah. Right. So that's a very big, I just came back from a discussion on long COVID and what does that mean and what is it altogether? And it's a big question. I don't know to answer that, I have to say. I didn't see right up to now, and there have been a lot of publications on this, something that convinced me as of what exactly the definition of this long COVID, what are the risk factors for that? I don't think we know. But what we showed in our study was that indeed 19%, nearly 20% of the patients who had very mild symptoms altogether, some of them were totally asymptomatic, they did have continuous symptoms even after 6 weeks. Most of these symptoms were fatigue. Some still didn't have taste or smell. Some could not go back to work because they were so fatigued and still with myalgias. We see these symptoms. What is the rate of these symptoms is a very big question. Most of the studies that have been published show very high rates, and I think they're very biased because it's very complicated to actually get just by questionnaires if you have long COVID or not. So, I'm not sure what the real numbers are, but obviously this is a disease that people do suffer for a long time.
Right. So it also raises the question, maybe the symptoms are not as threatening or fatal, but they are serious, which does raise the question. These are people who have been vaccinated, some of them even less than 6 months. Does that suggest to you, Professor, that the government is going to have to continue these preventive measures, maybe even toughen them? I don't want to say lockdowns, but mask wearing, more restrictions at the airport, maybe taking extra care in the schools?
So I think, again, I'm against lockdowns, and I'm very hopeful that we're not going to get there again, since, the population is mostly vaccinated. I think definitely the most important things right now is, one, to vaccinate nearly 1 million people who have not been, who are eligible to get the vaccine and did not receive it yet. And these are mostly children aged 12 to 16, but also older than that. Whoever did not get the vaccine up to now, the first dose, that's the most important thing, because we know now that the Delta variant is very severe. It's not just more infectious, it seems to be more severe. And obviously, people who are not vaccinated get a much more severe infection than people who are vaccinated. So that's, I think, the first aim right now. The second is to vaccinate the third dose of those who are 60 and older. And with that, I think we can lower the incidence of the severe disease. We're not going to change the incidence just by giving the third dose altogether, but we may be, I hope, that's what we're actually hoping for, is to see a stabilization or hopefully even a decrease in the rate and in the incidence of the severe disease, because those are mainly older people who are now getting the severe disease.
I mean, that certainly would be a desired result, but I guess the bottom line here is also we are going to have to learn to live with this coronavirus for some time until perhaps some more effective form of vaccine can be developed. Professor Gili Regev Yochai, thank you for joining us on The Rundown.
Thank you. Thank you.